Welcome to the 19th cohort of the Policy Advocacy in Genetics and Genomics course, a flagship educational program of the Pan-African PGS Education and Research Initiative, PAPERI. At PAPERI, we believe that the future of genetics and genomics in Africa cannot be shaped by scientific discovery alone. It requires strong policies, ethical leadership, equitable access, responsible data governance, and collaboration to ensure that the benefits of genomic advances reach the communities that need them most. The 19th cohort brings together an inspiring community of students, researchers, healthcare professionals, academics, and emerging advocates who share a common vision to strengthen the role of evidence, ethics, and African voices in shaping the future of genetics and genomics. Throughout this course, participants explore the scientific, ethical, legal, social, and policy dimensions of genomics, while developing the critical thinking, communication, leadership, and advocacy skills needed to transform scientific evidence into meaningful policy action. We are proud to welcome participants from across Africa, representing Ethiopia, Kenya, Nigeria, Uganda, Liberia, and Tanzania, together with an international participant from India. These diverse voices and experiences demonstrate something powerful. Genomics is global, but Africa must have a strong voice in shaping its future. This cohort is not simply about learning policy. It is about learning to advocate, learning to lead, and learning to turn scientific knowledge into action. Join us as we celebrate the voices, ideas, and aspirations of the 19th cohort of PAPERI's Policy Advocacy in Genetics and Genomics course. Our continent, our voices, our genomics future.
Imagine an Africa where genetic testing is being done for every person that has a risk factor for cancer or currently having cancer. Sounds beautiful, right? Yes. But my question to us today is Africa really ready for the implementation of this service? I am Owen Stanley from Nigeria, and I will be arguing against the topic: should African governments implement national policies to integrate genetic testing into standard cancer care? Join us as we debate and bring to light the different paths to this stop.
Hi, welcome to the upcoming debate. Should African governments implement national policies to integrate genetic testing into standard cancer care? No, I will be in the negative team. Wait for us on the 15th of August 2026. I'm Dr. Alfred Mitema from Kenya. Thank you.
Hi, my name is Anthony Wapa. I am from Nigeria, and I selected the topic: should African governments prioritize public funding for genetic testing of rare diseases, even when healthcare resources are limited? I will be in the affirmative team. Wait for us.
Despite the prevalence of malaria, cholera, HIV, and other communicable diseases in Africa, do you think that the African government should prioritize public funding for genetic testing of rare diseases in Africa, even when healthcare resources are limited? I'm Ezemere Onyedikachi. I'm from Nigeria, and I'm on the affirmative side for this debate. Join us as I and my team member will be sharing our opinion on this topic. See you soon.
Hey everyone, good morning, good afternoon, good evening from everywhere in the world. This is Tajudeen from Nigeria. I will be discussing on PAPERI: should genomic data generated from Africa population be stored and governed within Africa than primarily being stored in international database. I see this topic very convincing, and I'll be discussing in negation with Adobo, and I'm hoping to see you all on PAPERI to have this professional and scientific conversation. See you there.
Nigeria. I got selected in the 19th cohort of Policy Advocacy in Genetics and Genomics debate session. I selected the topic: should patients have full autonomy over whether to receive genetic testing results? Join us as we debate this sensitive topic. Looking forward to seeing you there. Thank you.
My name is Abigail Chidera Chigweze, and my debate topic is: should patients have full autonomy over whether to receive their genetic test results? And I'll be arguing against the motion. I look forward to an engaging debate session. Thank you.
Hello. We'll be glad to have you as we debate on the topic: should patients have the full autonomy to receive their genetic results? I'm Esther Alexander, together with my colleague Alois Kulwa from Tanzania. Will be debating on the topic more of on the affirmative side. So we'll be glad as you join us debate on that topic. Bye.
Hi everyone, my name is Christopher Mackey Freeman and I'm from Liberia. I'm pretty much excited to be a part of the upcoming 19th Cohort PAPERI debate session, and for that session I will be on a negative theme. So the topic we'll be debating on is: should genomic surveillance data be shared internationally without restrictions during public health emergencies? Well, I will be arguing that while timely sharing is important, but it shouldn't be done without a proper safeguard. So, yeah, wait for us, and I promise you it's going to be a thoughtful, important, and engaging discussion. See you there. Bye.
The voices you have heard throughout this video represent more than individual aspirations. They represent a new generation of professionals who recognize that the future of genetics and genomics depends on the policies we create today. From Ethiopia to Kenya, Nigeria to Uganda, Liberia to Tanzania, and beyond Africa to India, our participants have shared one powerful message. Science must reach people. Genomic innovation must be guided by ethics. Access must be equitable. And African voices must be part of the decisions that shape our genomic future. As we conclude this journey, we invite you to join us for the final debate session of the 19th Cohort of the Policy Advocacy in Genetics and Genomics course. Saturday, August 29th, 2026, 2 p.m. Cairo time. Join us as our participants challenge ideas, defend evidence, engage with different perspectives, and demonstrate the policy advocacy skills they have developed throughout the course. Come and celebrate their achievements, their courage to question, and their commitment to shaping a better future for genetics and genomics. Because the future of African genomics will not be built by one person, one institution, or one country. It will be built by a generation that is prepared to learn, collaborate, advocate, and lead. Our continent, our voices, our genomics future. PAPERI, empowering Africa's next generation of leaders in genetics, genomics, and policy advocacy.